Welcome everyone to another soulful episode of Healthy Kidneys After 60, a space where we slow down to listen to the whispers of our bodies and the wisdom of experience. I am your host, Jane Pauley, and today we are touching on a topic that sits right in the medicine cabinets of millions of homes across the country. We often talk about aging with grace, but sometimes the very things we rely on to keep us moving might be carrying a hidden cost. Joining me today is a man who has spent nearly 5 decades navigating the delicate corridors of human health, a voice of authority and compassion, Dr. Sanjay Gupta. Dr. Gupta, it is truly an honor to have you here to help us navigate these complex waters of health and healing.
Thank you so much for having me, Jane. It is a genuine pleasure to be here with you and your listeners. You know, after 50 years in clinical practice and seeing over 20,000 patients, I've realized that the most important conversations often happen not in the operating room, but in quiet moments like this, where we can truly reflect on how we care for ourselves. I've seen so many faces, heard so many stories of resilience, but also of preventable heartbreak. I hope that by sharing these experiences today, we can offer a bit of clarity and perhaps a lot of protection for those who are listening at home, wondering if they are doing the right thing for their long-term well-being.
Dr. Gupta, I want to start with something that has been weighing on my mind lately as I talk to friends and neighbors in our age group. We spend so much time worrying about our cholesterol numbers, our blood pressure readings, and the strength of our heart muscle as if they are these independent machines that just wear out over time. But lately, I've been hearing these unsettling whispers, almost like a mystery novel, where the primary suspect isn't the one we thought. I've heard you mention before that many of the heart issues we see in people over 60 might not actually start with the heart itself. It's a startling thought, isn't it? The idea that we might be inadvertently causing the very damage we are trying so hard to avoid. I'm curious, in all your years of looking at scans and talking to families, how often do you encounter a patient who comes in with a heart problem only for you to realize that the culprit was actually sitting right there in their bathroom cabinet, disguised as a helpful little pill?
Jane, you've hit on a truth that is as profound as it is tragic, and it's something that keeps many of us in the medical community up at night. To answer your question directly, it happens far more often than the general public realizes. We have become a society that views a pill as a quick fix for every ache, every pang, and every discomfort that comes with the passing years. But for those of us over 60, our internal chemistry is no longer the resilient forge it once was in our 20s or 30s. Our kidneys process things differently, our livers are more sensitive, and our hearts are working on a much finer margin of error. I often think back to the year Num Hang In La Num, which was a watershed moment in medicine. That was when the FDA issued a very stern, very public warning about a class of drugs we call NSAIDs, which includes things many people take as easily as candy, like ibuprofen or naproxen. The warning wasn't just a footnote, it was a loud alarm stating that these drugs significantly increase the risk of heart attack and stroke. Yet nearly 20 years later, I still see patients every single day who are shocked to hear this. They look at me with such genuine confusion and say, "But doctor, I bought this over the counter. It was right there next to the vitamins. Surely it can't be a threat to my life." And it breaks my heart because many of these individuals have hearts that were actually quite healthy until they were subjected to a constant daily barrage of these chemicals. We are seeing a silent epidemic where the cure for a stiff back or a swollen knee is slowly, silently putting a massive strain on the cardiovascular system. It's a matter of misplaced trust. People trust the packaging, they trust the convenience, and they trust the habit of taking something to feel better in the moment, without realizing they are trading a temporary relief for a long-term catastrophe.
It is truly frightening when you put it that way, Dr. Gupta, especially that phrase, misplaced trust. It makes me think of how we've been conditioned to believe that if we don't need a prescription, the risk must be negligible. We see the commercials with people running through fields of grain or playing with their grandkids after taking a pill, and we want that life. We want to be active. But what you're saying is that there's a shadow side to that convenience that isn't being talked about enough in the doctor's office. It feels like there is a disconnect between the relief we feel in our joints and the silent pressure building up in our chests? Is it that the heart is being forced to work harder, or is the medicine actually changing the way our blood or our vessels behave? I think for many of us, we need to understand the why behind the danger to really take it seriously. Why does something for a knee ache end up hurting the heart?
That is exactly the right question to ask, Jane. To understand it, we have to stop looking at the body as a collection of separate parts and start seeing it as a deeply interconnected web. When you take an NSAID, it doesn't just travel to your knee, it enters your entire systemic circulation. These drugs work by inhibiting certain enzymes, but a side effect of that is that they signal the kidneys to hold on to more sodium and more water. Now imagine your heart is a pump and your blood vessels are the pipes. If you suddenly add a lot more fluid into that system, the pressure inside those pipes goes up. This leads to hypertension or high blood pressure, which is the leading driver of heart failure. But it's even more insidious than just fluid. These medications can interfere with the way blood clots and how the lining of your blood vessels functions. They can cause the arteries to constrict, making it much harder for blood to reach the heart muscle itself. I've seen cases where a patient's heart was essentially being drowned from the inside out because their body was retaining so much fluid due to their daily pain medication. Many people come in complaining of shortness of breath or swollen ankles, thinking it's just old age. But when we look closer, we find that their heart is struggling to keep up with the extra volume caused by a pill they took for a headache or minor arthritis. It's a cascade effect. One small choice in the morning can lead to a massive emergency by the evening. The most dangerous part is that this damage doesn't always happen with a sudden chest pain. It's often a slow, quiet erosion of heart function over months or years. This is why I say that many hearts are damaged not by disease, but by the very things we use to mask the symptoms of aging. We have to move away from the blind trust model and start becoming much more protective of our internal environment as we age.
Doctor, what you just described about the heart being drowned from the inside really strikes a chord because it brings us to a very difficult crossroads for many seniors. I hear it all the time from people in my own circle who say that their knees or their backs hurt so much that they simply cannot function without some kind of relief. They feel trapped between a rock and a hard place where they either choose to live in constant agonizing pain that keeps them housebound, or they take these pills just to be able to walk to the mailbox or play with their grandkids. It is such a human dilemma, isn't it? We want to stay active to keep our hearts healthy, but the very pain that prevents activity leads us to take medications that might be doing the opposite. How do you help a patient navigate that terrifying choice when they feel like their quality of life is literally on the line every morning when they wake up?
It is perhaps the most heart-wrenching balance we have to strike in geriatric medicine, because pain is not just a physical sensation, it is an emotional thief that steals your independence and your joy. I remember a gentleman named Michael R., a 72-year-old retired teacher living in a quiet suburb of Ohio, who came to see me a few years ago. Michael was the pillar of his local community, someone who loved gardening and walking his golden retriever every single morning. But his osteoarthritis in his knees had become so severe that he felt he was losing himself. He started taking over-the-counter NSAIDs every day, just like millions of others, and for a while, it worked like a miracle for him. He told me he felt like he had found the fountain of youth because he could finally move again without that bone-on-bone grinding sensation. But what Michael didn't realize was that while his knees felt better, his heart was beginning to fail under the pressure of the fluid retention those drugs were causing. One evening, he found he couldn't even catch his breath while sitting on his porch, and his legs had swollen to twice their normal size. When he was rushed to the emergency room, it wasn't his arthritis we were worried about. It was acute heart failure. It was a devastating realization for him that the very help he was giving himself was actually pushing him toward a cliff. I had to sit by his bedside and explain that it wasn't the pain that nearly killed him, it was his desperate attempt to silence it at any cost.
That story of Michael is so sobering because it shows how easily a success story can turn into a nightmare without us even realizing it. It makes me wonder about the psychological toll on someone like him, who thinks he is doing everything right by staying active and taking what he believes is a safe medication. When you have to tell someone like Michael that he has to stop the one thing that was giving him his mobility back, how do they react? Is there a sense of betrayal, or perhaps a deep fear that they will now be relegated to a chair for the rest of their lives because their heart can no longer handle the solution?
The reaction is almost always a mix of profound shock and a deep, lingering fear of the future. Michael looked at me with tears in his eyes and asked if he was now a prisoner to his own body because the keys he used to unlock his joints were actually poisonous to his heart. It's a moment of total vulnerability where the patient feels like their body has betrayed them on two different fronts. We spent a long time talking about the reality that we can't just treat a symptom in isolation because the body is a single breathing ecosystem. I told him that we had to find a middle ground where we use topical treatments, physical therapy, and much safer alternatives that don't enter the bloodstream in the same way. The tragedy is that Michael is not an isolated case. There are thousands of Michaels in Ohio and across the country who are walking a tightrope every day. They aren't trying to be reckless, they are just trying to live. But we have to be honest with ourselves that the convenience of a pill often masks a much more complex debt that the heart eventually has to pay back with interest. It took Michael months to recover his heart function, and during that time he did have to live with some pain, which was incredibly difficult for him. But he eventually learned that a little bit of stiffness is a far better companion than a failing heart. We have to change the narrative from erasing pain to managing life, because the pursuit of zero pain in our 70s is often a path that leads straight to the cardiology ward.
It seems like we've been lulled into a false sense of security because these medications are so accessible, literally sitting on the shelves of every gas station and grocery store in the country. There is this inherent belief that if a government agency allows something to be sold without a doctor's note, it must be as harmless as a glass of water. But listening to you, it feels like we are playing a very dangerous game of chance every time we twist off that cap without a second thought. Are we as a society simply too comfortable with these substances? It feels like we've lost our healthy respect for the power of chemistry, especially when it comes to the delicate balance of an older person's cardiovascular system.
You're absolutely right, Jane. We have developed a dangerous level of complacency. We often forget that over-the-counter does not mean free of consequence. In fact, for the elderly, these can be the most dangerous drugs precisely because there is no pharmacist or doctor standing there to check your history before you buy them. The research from major cardiac centers and the repeated warnings from the FDA are clear. After the age of 60, every single dose of an NSAID is essentially a calculated risk. These drugs can cause a spike in blood pressure within hours of ingestion, and for a heart that is already slightly enlarged or stiffened by age, that spike can be the tipping point. I often tell my patients that taking these pills regularly is like redlining an old car engine. It might go faster for a while, but you are drastically shortening the life of the motor. We see a significant increase in the risk of stroke and myocardial infarction, even with short-term use, in patients who have pre-existing heart conditions. And the scary part is that many seniors don't even know they have a condition yet. They feel fine, so they take the pill, and that pill becomes the catalyst for a silent disaster. We need to treat these medications with the same gravity we treat high-stakes surgery. They are powerful tools, but in the wrong hands or the wrong bodies, they are weapons.
It's a powerful metaphor, comparing our bodies to an old car engine being pushed too hard. It makes me think about how many people are out there right now, maybe just feeling a little bit of a headache or a minor muscle pull, reaching for that bottle because it's the easy thing to do. If we are to change this culture of pill-first thinking, what is the first thing a person should ask themselves before they take that ibuprofen? Is there a way to weigh that gamble in the moment, or should the default answer for someone over 60 simply be no until they've spoken to a professional?
The default should certainly be a very high level of caution. Before reaching for that bottle, one must ask, is this pain a threat to my safety or just an inconvenience? If it's an inconvenience, we should look at heat, ice, rest, or topical creams first. We have to stop thinking of these pills as the first line of defense. I've seen so many people who ended up in the ICU because they took a double dose of a common painkiller just to get through a round of golf. They didn't see the connection between that pill and the heart palpitations they felt later that night. We have to educate ourselves to realize that the relief of a headache is never worth the risk of a stroke. The heart is a very forgiving organ, but it has its limits, and chemical interference is one of its greatest challenges. When we are young, our kidneys can flush these toxins out quickly, but as we age, they linger. They stay in the system longer, doing more damage to the delicate lining of our arteries. It is a slow, cumulative process of injury that we often only recognize when it's far too late to reverse it.
Now, this next part of our conversation is something that I think will truly shock a lot of our listeners because we aren't even talking about pain anymore. We are talking about something as common as heartburn and acid reflux. So many of us carry those little bottles of stomach acid blockers like they are essential travel companions. We take them for years, sometimes decades, just to enjoy a spicy meal or to stop that burning sensation in our chests at night. But you've mentioned that these stomach medications can actually cause the heart to lose its rhythm. That seems so counterintuitive. How does a pill for the stomach end up messing with the electrical signals of the heart? It feels like we are pulling on a loose thread in a sweater and the whole thing is starting to unravel in ways we never expected.
It is a perfect example of the unintended consequences of modern medicine. When we talk about drugs like omeprazole or other proton pump inhibitors, we are talking about medications that are designed to be used for a few weeks, yet millions of people stay on them for a lifetime. I think of a patient named Helen S., a 68-year-old grandmother living in Florida. Helen was a vibrant woman, very active in her church, but she had suffered from chronic acid reflux for years. She took her stomach medication every single morning religiously, thinking she was protecting her esophagus. But over time, she started feeling these strange flutters in her chest, like a bird was trapped in there trying to get out. She felt dizzy, tired, and eventually she fainted while she was out grocery shopping. When she was brought in, her heart rhythm was completely chaotic. After running some tests, we discovered that the medication she was taking for her stomach had actually blocked her body's ability to absorb magnesium. Magnesium is the master mineral for the heart. It's like the conductor of an orchestra. Without it, the heart's electrical system begins to misfire. Helen's heart was literally starving for the minerals it needed to stay in rhythm, all because her stomach medicine was too effective at changing her internal chemistry. It was a terrifying experience for her because she thought she was having a massive heart attack, when in reality, her heart was just crying out for help because of a nutrient deficiency caused by a harmless stomach pill.
That is a terrifying thought, that by fixing one problem, we are creating a deficiency that can literally stop the heart or send it into a frenzy. Helen must have been so confused to hear that her stomach medicine was the reason she was fainting. It makes me wonder about the millions of people who are taking these drugs right now. Do they even know that they need to be checking their magnesium levels? It feels like a massive gap in our healthcare system where we prescribe a pill for life without ever checking the collateral damage it's doing to our mineral balance.
You've touched on a very critical point, Jane. The disconnect is vast. Most people, and unfortunately even some doctors, don't make the connection between long-term acid suppression and cardiac arrhythmias. I had to explain to Helen that her heart is an electrical pump, and those electrical signals depend on a very precise balance of electrolytes like magnesium and potassium. When you suppress stomach acid for years, you change the environment where these minerals are absorbed. Helen's story ended well because we were able to supplement her magnesium and slowly wean her off the medication, but many aren't so lucky. They get diagnosed with a permanent heart rhythm disorder and put on even more medications like blood thinners or beta blockers when the root cause was actually in their medicine cabinet all along. It's a vicious cycle of over-medication. Helen told me later that she wished someone had just told her to change her diet or lose a few pounds instead of handing her a pill that would eventually make her heart skip a beat. We have to start looking at the long-term price of these lifestyle drugs. They aren't just neutralizing acid, they are altering the very foundation of how our cells communicate. For someone over 60, that loss of magnesium is like removing the brakes from a car going downhill. The heart becomes irritable, unstable, and prone to dangerous rhythms that can lead to sudden cardiac arrest.
It's deeply unsettling to think that the very things we do to protect ourselves, like preventing the discomfort of acid reflux, could be setting us up for a much more catastrophic event. We often hear about clinical trials and studies, but it feels different when you realize these are real people who are suffering. You mentioned that there is a broader risk here beyond just mineral deficiency, that there's actually a link to things like heart attacks. When we look at the data, it's not just a few isolated cases like Helen's, is it? There seems to be a growing body of evidence that suggests these stomach medications might be doing something even more direct to our arteries. How do you explain that to a patient who feels they absolutely need that medication just to eat or sleep comfortably?
It's a conversation that requires a lot of empathy because I never want a patient to feel like I'm taking away their comfort, but I have to prioritize their life. There was another patient, Margaret L., a 75-year-old woman from Illinois, who is a very sharp, active person. She had been on high-dose PPIs for over a decade. She came to me not for heart issues, but because she was worried about her overall health as she aged. When we looked at her history and some recent observational studies, I had to share some difficult news. These studies, involving hundreds of thousands of people, have shown a persistent link between long-term use of these stomach drugs and an increased risk of heart attacks. It's not just about magnesium anymore. It's about how these drugs might affect the endothelium, which is the delicate inner lining of our blood vessels. When that lining is compromised, the vessels can't relax and dilate properly, which is a major precursor to a heart attack. Margaret was stunned. She said, "Doctor, I thought I was being a good patient by following my previous doctor's orders for 10 years. It was a moment of profound realization for her that the medical advice of yesterday might be the health hazard of today. We are learning in real time that these drugs have a much darker side when used outside of their intended short-term window."
Margaret's story is so representative of that good patient mentality where we do exactly what we are told for years without questioning it. It's almost a betrayal of that trust when the science changes and we find out we've been putting ourselves at risk. For someone like Margaret, who has been on these medications for such a long time, is the damage reversible, or is there a permanent change to the heart and the vessels that they just have to live with? I think that's what many people are afraid of, that they've already done the damage and there's no going back.
That fear is very real, but there is also a lot of hope. The body has an incredible capacity to heal if we give it the chance. For Margaret, the first step was a very slow, managed tapering of her medication while we addressed her diet and lifestyle. We found that once she stopped the daily pills, her vascular function actually started to improve. Her blood pressure became easier to manage, and she felt a sense of clarity and energy she hadn't realized she had lost. I told her that the heart is like a garden. If you stop pouring salt on the soil, the flowers can eventually bloom again, but it requires a proactive shift. We can't just wait for a crisis to happen. I often ask my patients, how many of you are taking a stomach pill but haven't had a magnesium test in the last 5 years? Almost no one raises their hand. We are flying blind. We are treating the smoke but ignoring the fire that is slowly burning through our cardiovascular health. Margaret eventually became an advocate in her senior center, telling her friends to go get their electrolytes checked and to question their long-term prescriptions. She realized that being a good patient actually means being an informed and vocal partner in your own care, not just a passive recipient of a refill.
This brings us to another very common scenario, especially as we head into the colder months. We all get those nagging colds. the stuffy noses, and the congestion that makes it impossible to sleep, most of us don't even think twice about grabbing a multi-symptom cold pill or a nasal spray to get through the night. It seems so innocent, just a way to breathe a little easier for a few hours. But you've warned that for a senior, these simple cold remedies can be like pouring gasoline on a fire when it comes to blood pressure. It's a scary thought that a stuffy nose could lead to a stroke. How does a simple decongestant turn into a cardiac emergency in someone over 60?
It's one of the most common ways we see healthy seniors end up in the emergency room during the winter. I remember a case very clearly, a woman named Margaret L., 75 years old, from a small town in Illinois. She was a very healthy woman, no history of heart disease, but she caught a nasty winter cold. She went to the pharmacy and bought a standard brand name cold and flu medicine that contained pseudoephedrine. She just wanted to clear her head so she could sleep. But within 2 hours of taking that first dose, she felt her heart racing like she had just run a marathon while lying in bed. Her blood pressure shot up to a level that was dangerously close to causing a stroke. You see, Jane, these decongestants work by shrinking the blood vessels in your nose to reduce swelling, but the drug doesn't know to stay in your nose. It travels through your entire body, causing all your blood vessels to constrict. For someone like Margaret, whose arteries are already less flexible due to her age, this sudden constriction is a recipe for disaster. It forces the heart to pump against a much higher resistance, and the result can be a hypertensive crisis or a dangerous arrhythmia. She was lucky her husband noticed she was acting confused and got her to the hospital in time.
It's so frightening to think that something as mundane as a cold could lead to such a high-stakes medical event just because of a choice at the pharmacy. Margaret must have been absolutely terrified, and it makes me think about how many people are sitting at home right now, feeling a little under the weather and reaching for those same pills. Is there a safer way for us to handle a cold, or should we just avoid those multi-symptom pills altogether once we hit a certain age? It feels like we need a completely different medicine cabinet as we get older.
We absolutely do. I told Margaret that from now on she has to look for the HBP or heart-safe versions of cold medicine which don't contain those powerful stimulants. But better yet, I told her to go back to the basics: saline nasal sprays, steam, and rest. We have become so intolerant of even the slightest discomfort that we are willing to risk our lives for a clear nose. I had to explain to her that the shrunk vessels in her nose were also shrunk vessels in her heart and brain. It's a systemic shock to the body. Margaret told me later that she never realized how powerful those little red pills were. She just thought they were there to help. That's the danger. The packaging is so friendly, but the chemistry is aggressive. We have to realize that as we age, our margin of safety gets thinner. We can't handle the same stimulants we did in our 30s. For a 75-year-old heart, a standard dose of a decongestant can be the equivalent of 10 cups of coffee all at once. It's a massive strain that many hearts simply aren't prepared for. Margaret now reads every label with a magnifying glass, and she's right to do so. Your life is worth more than a few hours of nasal relief.
Now, we're moving into a territory that might be even more controversial because it involves something we've been told is essential for decades. As we age, we are constantly reminded about our bone density and the fear of fractures. So many of us, especially women, have been taking calcium supplements religiously for years, thinking we are building a fortress for our skeletons. But there's this disturbing new research coming out of major institutions in the US and Europe suggesting that these supplements might not be going to our bones at all, but instead ending up in our arteries. It's a chilling thought that in our quest to strengthen our bones, we might be literally petrifying our hearts. How do we make sense of this, doctor? It feels like the ground is shifting under our feet regarding everything we thought we knew about supplements.
You are touching on one of the most significant shifts in nutritional science in the last decade, and it is indeed a very difficult pill to swallow, pun intended. For years, we thought that more was better when it came to calcium, but the human body is a very complex regulator. When you take a high-dose calcium pill, you get a sudden massive spike of calcium in your blood. Your bones can only absorb so much at one time. So, Where does the rest of that calcium go? Recent studies have shown that it often deposits in the soft tissues, most notably the walls of our arteries. This is what we call vascular calcification. Imagine your smooth, flexible arteries becoming as stiff and brittle as a porcelain pipe. This makes the heart work much harder to push blood through, and it increases the risk of those plaques rupturing, which causes heart attacks and strokes. I've seen heart scans of people who were taking massive amounts of calcium supplements, and their coronary arteries looked like they were made of stone. It's a heartbreaking irony that in trying to avoid a broken hip, these people were setting themselves up for a broken heart. We are now realizing that calcium from food like dairy, leafy greens, and sardines is absorbed slowly and safely, but calcium from a pill is a completely different story for the cardiovascular system.
This is such a paradigm shift. I can almost hear the gasps from our listeners who have been taking these supplements for years because their doctors told them to. It feels like a betrayal of the very health goals we were pursuing. If someone has been taking these for a long time, should they just stop? And what does this mean for our bones? It feels like we are being told to choose between our skeleton and our heart, which is a choice no one wants to make. How do you guide a patient through that kind of confusing information?
It's not about choosing one over the other. It's about choosing the right delivery system. I always tell my patients that the best pharmacy is the grocery store. When you get calcium from food, it comes with other nutrients like vitamin K2 and magnesium that help direct that calcium into the bones and keep it out of the arteries. The supplement industry has marketed these high-dose pills as a safety net, but for many, it's actually a trap. I've had many patients who were terrified to stop their supplements because they were afraid their bones would crumble. I had to show them the data that for many people the benefit to the bones is actually quite small, while the risk to the heart is significant. We have to move toward a more nuanced approach where we test for deficiencies before we supplement and focus on weight-bearing exercise and a mineral-rich diet. I tell them, your bones need stress and food, not just a chemical spike. It's about balance. We have to stop looking for the magic bullet in a bottle. The heart is a very delicate muscle, and it doesn't do well when it's being walled in by excess minerals it doesn't know how to process. It's a conversation about longevity in its truest sense, keeping the whole system functional, not just one part at the expense of another.
It's so clear that we need to be more vigilant about everything we put in our bodies, even the things we think are helpful. You mentioned earlier how a single patient story can really illustrate the danger of these hidden habits. I'm thinking about the stories of people who were doing everything right but still ended up in trouble. There's a certain kind of person, we all know them, who is very proactive about their health, maybe even a little too proactive, taking every supplement and preventative pill they can find. It's almost a form of health anxiety that ends up causing the very thing they fear. Have you seen that play out in a way that really changed how you talk to your patients about their daily routines?
I certainly have, and the story of Linda P. is one that stays with me. Linda was a 70-year-old woman from California, a retired librarian who was incredibly diligent about her health. She walked 5 miles a day, she didn't smoke, and she was a vegetarian. But Linda had a deep-seated fear of aging, so she took a handful of supplements every morning, including high-dose calcium and several natural anti-inflammatories she found online. She thought she was building a shield around her health. One afternoon, while she was out on her walk, she felt a sudden crushing weight on her chest. She ended up in my care after a minor myocardial infarction. When we looked at her labs and her imaging, we found significant calcification in her coronary arteries despite her perfect lifestyle. Linda was devastated. She said, "Doctor, I did everything right. I took all my vitamins. How could this happen?" I had to gently explain to her that she had inadvertently been over-managing her body. The high-dose supplements she was taking were actually contributing to the hardening of her arteries. It was a hard truth for her to accept, that her effort to be healthy was the very thing that led to her heart attack.
That is such a poignant story, and it really highlights the danger of self-prescribing, even with things we think are natural. Linda must have felt so disillusioned. It makes me wonder about the lesson we should all take from her experience. It's not just about the specific pill, is it? It's about the mindset that we can somehow supplement our way out of the natural process of aging. How did Linda change her life after that? Did she find a way to trust her body again without the shield of all those pills?
It was a long journey for her to rebuild that trust. We spent months working on a plan that focused on less is more. We stripped away almost all of her supplements and replaced them with a very intentional, nutrient-dense diet. We focused on hydration and natural ways to manage inflammation, like turmeric in her food rather than a high-dose pill. The most important thing for Linda was learning to listen to her body instead of trying to control it with chemistry. She eventually realized that she felt better, more energetic, less heavy, without the mountain of pills. She told me later that she had been living in a state of constant fear, and the pills were her way of trying to buy a sense of safety that doesn't actually exist in a bottle. Now, she's an advocate for minimalist medicine. She tells everyone at her hiking club to talk to their doctor before they add even a single vitamin to their routine. Her heart has recovered remarkably well, but the lesson she learned was far more than physical. It was about finding peace with the aging process and realizing that our bodies are incredibly wise if we just stop interfering with them so much. We have to remember that every supplement is a message we are sending to ourselves. We need to make sure we aren't sending a message of chaos.
As we approach the end of this incredibly eye-opening conversation, I want to pivot towards something very practical. Many of our listeners are probably looking at their medicine cabinets right now with a bit of newfound suspicion and maybe even a little bit of fear. We don't want anyone to panic and throw everything away, but we do want them to be smart. If you were sitting down with a friend who just turned 60, what are the absolute golden rules for managing their medications? What should they be carrying with them to every doctor's appointment? And what questions should they be asking that they might have been too shy to ask before?
The first and most important rule is the more eyes on your medication list, the safer you are. I tell everyone over 60 that they must have a physical printed list of every single thing they swallow: prescriptions, over-the-counter pills, vitamins, herbs, and even protein powders. You should take this list to every single appointment, whether it's the cardiologist, the podiatrist, or the dentist. Often, one doctor doesn't know what the other is prescribing, and that's where dangerous interactions happen. Secondly, you must ask your doctor why for every medication. Ask, is this for a short-term symptom or a long-term condition? When can we try to stop taking this? We have to move away from the forever pill mentality. Another crucial piece of advice is to always ask about the heart and kidney impact of any new drug. Say, yeah, doctor, I'm concerned about my heart and kidney health as I age. Will this medication affect my blood pressure or my mineral balance? Being an active patient means you are an advocate for your future self. You aren't being difficult. You are being responsible.
That forever pill mentality is something so many of us fall into. We just assume once we start, we never stop. It's so empowering to hear that we can and should ask about an exit strategy for our medications. It makes me realize that we have more control than we think. For the people who might be worried that their doctor is too busy to have these long conversations, how do you suggest they start? Is there a way to make this part of a standard checkup without feeling like you're taking up too much of their time?
You have to be direct and organized. Hand them that list the moment you sit down and say, these are my priorities today. Doctors actually appreciate a patient who is organized because it makes our job easier and safer. I also suggest involving your pharmacist. They are often the most underutilized resource in healthcare. A good pharmacist can look at your entire list and spot potential heart risks that even a busy doctor might miss. I also tell my patients to do a medicine cabinet audit every 6 months. If you haven't used it, or if you don't remember why you're taking it, it's time to have a conversation. We have to stop treating medicine as a passive experience. It is a high-stakes partnership. Remember, your heart is a finite resource. Every chemical you introduce has to be justified. I want people to feel confident enough to say, I'd rather try a lifestyle change first before I start this pill. That is not a sign of weakness, it's a sign of wisdom. We are the guardians of our own health, and our most powerful tool isn't a prescription pad. It's the courage to ask the right questions and the discipline to live a life that doesn't require a dozen shortcuts in a bottle.
Dr. Gupta, this hour has been such a journey from the shock of hidden dangers to the hope of reclaiming our health through simple, mindful choices. It really brings home the idea that our hearts aren't just pumps. They are the historians of our lives, carrying every stress, every joy, and every choice we've made over the decades. As we close today, I'm left thinking about how much we owe these hearts of ours. They've worked tirelessly since before we were even born, never taking a single second off. It seems only right that we treat them with a bit more reverence and a lot more protection as we enter these golden years. What is the one final thought you'd like to leave with our listeners who might be feeling a bit overwhelmed by everything they've heard today?
My final message is one of profound respect for the human body. Your heart has beaten over 2 billion times by the time you reach 60. It has sustained you through every challenge and every triumph. It is an incredibly resilient organ, but it is not invincible. Please do not take its silence for granted. Just because it isn't complaining today doesn't mean it isn't being stressed by the choices you are making in the pharmacy aisle. My hope is that you don't walk away from this feeling afraid, but feeling empowered. You have the power to protect that rhythm. You have the power to say no to unnecessary chemicals and yes to the things that truly nourish you. Be kind to your heart. It is the only one you have, and it wants to keep beating for you for a very long time. Listen to its whispers so you never have to hear its screams. It has been a true privilege to share these stories with you today, Jane. I hope that even one person listening feels the courage to have that difficult conversation with their doctor and perhaps saves themselves from a preventable heartbreak. Thank you for creating this space for these vital conversations.
Dr. Gupta, thank you. Your words are a powerful reminder that our health is a gift we must actively guard, not just something we maintain with a routine of pills. You've given us so much to think about, and more importantly, you've given us the tools to act. To our listeners at Healthy Kidneys After 60, thank you for spending this time with us. We hope this conversation has touched you and perhaps opened a new door to how you view your own wellness journey. Remember, you are your own best advocate, and your heart deserves your full attention. If you found today's episode helpful, please consider subscribing to our podcast and sharing it with a friend or a loved one. Each share could be the start of a life-changing conversation for someone else. We have so many more deep dives coming up, and we don't want you to miss a single one. Until next time, take a deep breath, listen to your body, and take care of those hearts. They've earned it. Good night and be well.